Okay, so I know more people are going to start joining us. We are already at 73, but in the sake of time, I just wanted to welcome everyone again. I wanted to mention that we will see more people coming. The last check today, we had over 160. So welcome everyone. I am Anka Badrina and I am the executive director of Building One Community. I've been with our organization for nearly 6 years now, and I came into my current role as ED over the summer. My daughter told me that I have to say that I love our organization. So there I said it. She wouldn't forgive me if I don't. So it is my pleasure to present this evening program to you. And as many of you know, on Monday we kicked off Welcoming Week in partnership with Welcoming America. Building One Community's mission is to advance the integration of immigrants and their families into our larger community. So in our everyday work and with initiatives like this one, we strive to make Stanford a welcoming place for all. Our goal is to bring together immigrants, refugees, and longtime residents to build strong connections and to achieve collective prosperity. So Welcoming Week reminds us to find new ways to connect, to bring all people together and to develop that greater understanding and mutual support. So with Welcoming Week as a backdrop, I am thrilled to present the screening of Love, Life, and the Virus, a film by Oscar Guerra about a mother's fight to survive COVID and see her newborn baby. It is also a film about how Stanford actually rallied around them and provided support at so very many levels. So after the screening, which will last about 40 minutes, we will come back here to a great panel discussion. I wanted to let you know that we will be recording this session for internal purposes only. So now it is my great pleasure to introduce you to our panelists, Dr. Michael Bernstein, who is the Associate Director of Pulmonary and Critical Care of Stanford Hospital, and the physician who oversaw care for Sully, the mother in this evening's story. Welcome, Dr. Bernstein. Oscar Guerra.
Thank you so much for having me.
Wonderful. Oscar Guerra, who is the director and producer of today's PBS Frontline documentary, and who has also his own production company. Welcome, Oscar.
Thank you, Anka. Hi, everyone.
And Luciana Lira, bilingual teacher at Hart Magnet School, one of the many heroes of our narrative, who graciously took care of the newborn child while the family was actually stricken by COVID-19. So welcome, Luciana.
Hello, everyone. It's a pleasure to be here tonight.
We will shortly start the screening of this incredibly well done and inspiring documentary. Our Q&A will begin at around 7:45 after the film wraps up. To ask our panelists a question, please use the Q&A box, as you can see on the screen right now. And we will be sharing your questions at the end of the conversation. So, but now please enjoy the film and we will see you right here, right after. See you soon.
Esta enfermedad me agarró de sorpresa, pues. Dije yo, es esto lo que tiene, porque muchas personas ya me lo habían dicho. Cuando mi esposa se puso grave, me dice, me duele la espalda. Y yo la veía con tos y poco oxígeno. Y al siguiente día yo ya vi que ella se fatigaba mucho, y mucha tos, y ella me decía, el bebé se me mueve mucho, no me deja dormir. Vi que ella estaba demasiado grave y la llevaron para el hospital. Yo sentía que a ella le faltaba oxígeno, pues. Y entonces dije yo, no, pues esto es lo que ella tiene. Y le hacía falta un mes todavía a mi bebé para que naciera. Y entonces en el hospital me dice, no, pues le vamos a adelantar el parto a mi esposa porque el bebé está perdiendo oxígeno. Y yo me quedé con el otro niño que tengo acá de 7 años y nada más solo pidiéndole a Dios porque no tenía ninguna otra persona que me ayudara. Entonces, como el día 4 de abril, me dijeron que ya mi bebé había nacido. Yo dije, ok, gracias a Dios. Yo le dije, ¿y mi esposa cómo está? Pues fíjate que de ella no te puedo dar razón ahorita, porque ella ya está en coma.
We need a medium-sized leave-in pad cut in half.
Okay.
Currently, we have Queen's specimen bags. We need to put this in.
Zuli's case was very unique for us because this was one of our first few cases with a mom who was extremely sick and COVID positive. Was the baby going to be extremely sick and infected as a result of COVID too? We did not know that at that time. There was not a lot of data there. Now we know that most babies don't get extremely sick with COVID, but at that time we were not aware of that.
The baby did have several tests done, and he tested negative, but we knew that mom was positive, and then we had to safely execute on a plan for him to go home to a safe environment.
Billy's gonna check your temperature.
Me dice alguien del hospital, tienes que venir a traer a tu bebé. Entonces, ya cuando me dijeron que mi esposa tenía esa enfermedad, dije yo la tengo también, ¿no? Ya estaba más seguro que yo la tenía. Me hubiera convertido yo en un asesino con mi hijo. Pero con la que yo tengo más contacto es con Miss Lira. La maestra Miss Lira. Me dice, Zuli me llamó, que me hiciera cargo del bebé.
I said, listen, Marvin, I am willing to help 100%. I really did not know this family. I mean, Zuli just came to the United States, I think, a year ago, and Marvin has been here for 6 years. And Junior is my bilingual student. And that's how I met them. When we were able to test Marvin and Junior, they were both COVID-19 positive. This baby would have not stand a chance if he went home with his father with COVID-19 and Junior. He's just a preemie baby. I went to the hospital with Marvin. Oh my God. Hi, baby. Zuli, mira tu hijo, Zuli. It wasn't easy because, you know, he saw his son for the first time and he couldn't even go near him. Mira tu papá, mira tu papá. And it really broke my heart. After going through such a big trauma, not even knowing if your wife was going to make it. Tu papá también te quiere mucho, bebé. Tu mamá te va a estar esperando. I took the baby home. Right, baby? Hold it, hold it. There you go, you can trust. Right, buddy? I was thinking I was staying with the baby for 1 and 2 days. And now I am, 3 weeks.
So how many patients do we have now?
We have 9.
Zuli, who was young compared to most of our patients, she was brought down to the ICU knowing that her oxygen level had gotten precariously worse. We decided that we were going to have to intubate her or put her on a breathing machine to help support her oxygen.
This patient over there, when I started him, he was on 100% FiO2. The night nurse gave me my assignment, which was Suli, and she said she's 30 years old, she just had a baby, she's really sick, she was super unstable overnight, and she's going to be your only patient right now, so you only have to focus on her. She was absolutely one of the sickest patients on the floor at that time. And I thought she very well might not make it through this. And that was terrifying.
While she was intubated, she spent a good majority of the time actually upside down on a fancy bed that actually takes you and turns you completely over. So when you're on that, she was completely in a coma.
In my head, I said, she's not gonna die in my time. I'm not gonna let that happen.
Is it okay? Okay.
Zuli.
She was in the ICU almost 3 weeks total, I think. She was on the ventilator for about 18 days, and then another day or 2 afterwards as we were waking up and regaining her strength. It takes a while to get their body back up and running.
Do you need to rest?
It's an unfortunate consequence of being in the ICU. It's something we try to work through with our patients. There's issues of patients who have PTSD from being in the ICU.
Cuando desperté no daba ni dónde estaba, según yo. Estaba en el 2005, el 2000, no me imaginé que estaba en el 2020. Según yo que estaba en Guatemala, no acá. En mi imaginación, el más grandecito Junior. Yo miraba a Junior acá, gateando ahí, y no le ponían asunto. Que él decía, mamita, que no tengo hambre. Pero yo miraba que las enfermeras lo hacían a un lado, lo pateaban. Yo le decía, no pateen a mi hijo.
Most people who are in the ICU take weeks, if not months, to gain her strength back. I imagine that's what she's going through. But most people will tell you even their mind isn't back where they were.
Pues quiero que abrazarlo, tenerlo, y ya salir y estar con mi esposo y mis 2 hijos.
Fíjense. Ahí está. Esta tarjeta tiene $50. ¿Ok? Para que vaya a hacer la compra. No se le olvide.
We met Zuli and Marvin at the very beginning when she was hospitalized. When Zuli was fighting for her life, we had people going every day to provide food to him and to Junior, toys to him. There was a phone call every day. How are you doing? What else do you need?
Para tener, usted tiene recién un año acá.
Stanford is a very unique community in which, almost 35% of the population is foreign-born.
Ahí está la información del virus también para que se la lleve para su casa, para que le cuide bien.
And the pandemic was affecting families like Suli's disproportionately. The whole pandemic and how it evolved and how fast it all happened, this is still hard to comprehend for all of us. So many people were losing their jobs. So many families did not have a way to feed their kids or pay the rent. So the community at large really rallied.
He's a very good baby. Here, buddy. Do you know that? He's okay? Okay.
I came here when I was 17 years old from Brazil. My husband was an illegal immigrant. He came here when he was 19 years old. And look at him now. I mean, he is an immigrant who worked his way up. It's the American dream.
¿Qué tal?
Hi.
Yo le llamaba nada más porque me dijeron del hospital que ella ya tiene salida, pues.
¿Salida cuándo?
Hoy o mañana me dijeron.
Pero te dijeron que iba a ser hoy. Qué raro, porque no. Necesitamos hablar con los doctores que no nos llamaron hace, yo creo que 1 o 2 días que estoy intentando hablar con ellos. Ay, call on hold.
I know, it's that time, buddy. I know. It's okay.
Oh, it looks like the hospital. Hello?
All of a sudden, I get a phone call, and it's a doctor from the hospital, and they just tell me, Zuli's being discharged today at 4 o'clock. Somebody needs to be here to pick her up.
Okay, we're sending her home, but her husband was not, he's COVID-19 positive, and the brother is COVID-19 positive, and the baby's COVID-19 negative. So
I was in shock when I received that phone call because I really thought she was going to still be hospitalized for 1 more week at least.
But if it was a person with insurance, then they would probably send her to a rehab, right? When do we have to pick her up? How does this work? I mean, I'm just a teacher. I don't know how this works.
I needed to pick her up at 4 o'clock. And I looked at my watch and I'm like, wait a second, it's 2:45.
We can't. I am sorry. You're telling me you're giving me 1 hour to make arrangements for a patient who's been in induced coma for a month. You cannot discharge this woman in 1 hour. I am sorry. I just can't.
How to get Suli home became an entire project for all of us. I mean, their house, it seemed like thousands of miles away. So I called the ambulance, I made the appointment. I told them to be there as late as possible to give us time to prepare. Then we went over to the house to wait for her to arrive. ¿Cómo estás, mi amor? Muy feliz de que vas a ver a tu mami.
Ah, exacto. Ah.
Junior! Dile hola a tu abuelita, Junior. Espérate, ¿tú ves a Junior ahí o no?
Junior, sí, está en la puerta.
They're coming now. Do you have a second? Ah, Julie! Tu madre está aquí, Julie. Tu familia, tu hijo. Welcome home, que sea bienvenida, Julie.
Yo creí que ya nunca la iba a volver a ver. Dije, oh Dios mío, no me hagas esto. ¿Qué hago yo con mis 2 niños recién nacidos y yo infectado?
Cuando vine aquí a casa me sentí feliz de que volví a ver a mi hijo Junior, a mi esposo Marvin. Neisel todavía no estaba con nosotros porque salí positiva todavía del coronavirus. Y mi esposo Marvin y Junior también estaban positivos todavía.
Mamá ya está en la casa. Ay, qué linda. Ya estás en la casa.
Ready? Happy birthday to you. Happy birthday to you. Happy birthday, baby Naisel. Happy birthday to you. Zuli, míralo tu hijo. Mira quién está aquí con 1 mes de vida. Hoy él cumple 1 mes de vida, Aurora.
Un besito para Naisel. Dios bendiga a mi hijo que está cumpliendo 1 mes. Ya, y que Dios me lo bendiga y que me la bendiga a usted.
Nosotros queríamos ya tener a Neisel acá, pero no podíamos, porque corríamos riesgo de que él se podía contagiar del coronavirus.
Bye, guys.
Hasta luego.
Antes de la pandemia, nuestra vida era muy diferente, éramos felices, pero que vino la pandemia, todo cambió. Marvin trabajaba en un restaurante. Me he dedicado a cuidar a mi hijo Junior, pero ya cuando vino la pandemia, pues todo fue más difícil, más encerrados, para protegerse más uno. Marvin perdió su trabajo y ahí fue donde comencé yo a enfermarme. Yo resulté como una gripe, pero nunca me imaginé de que yo iba a resultar con el COVID-19 porque no salía de la casa.
Saliendo para la clínica, primero Dios que todo salga. Quiero todo esto va a salir negativo porque quiero tener a mi hijo a mi lado ya 1 mes de haber nacido y no puedo abrazarlo, besarlo. Ya papi, ya. Si Dios no nos lo hubiera puesto en mi camino, tal vez ya nos hubiéramos muerto, tal vez todos. Porque en esta situación sin seguro, sin dinero, uno acá se muere, pues. Yo no quiero, dije yo, contaminar a otras personas y no se le desea a nadie. Esto no es un juego.
Thank you for holding. Your call is very important to us. Okay. You have 2 tests done, and one was the nasal, and the other one was the blood work. The nasal swab came back. The swab is positive.
Y el de Junior.
Junior is the same also.
Dios mío. Tranquila, ¿no?
Yo creí que Marvin y yo no ya estaban negativos ya, porque mi hijo estuviera acá. Ya no aguanto esto yo.
No te pongas así. No, Dios, todo va a salir bien.
¿Cuándo vamos a tener al nene aquí entonces? Estoy, me tiene atormentada. Yo a veces le digo a él, mami, que solo iba a venir a Estados Unidos a morir. A veces él dice, yo ni vi a mi hijo cuando me lo sacaron. Yo le digo a él, ni siquiera tú lo viste de lejos. Yo le digo, yo no lo vi ni cuando me lo sacaron ni nada. Quizás eso no me deja dormir y las pesadillas, lo que viví cuando estaba en coma. Ay, Dios mío.
The whole testing was so complicated and so convoluted. And I think this is just so typical of the challenges that you face when you have a language barrier, when you have a cultural barrier, when you're scared. We are very, very hopeful that her rapid, fast test results in an hour and a half. They will give us a call.
Mari, ¿me oye?
Sí.
Buenas noticias, su hija está negativa por los resultados. ¡Wow! ¡Qué emoción! Estoy tan feliz por ustedes.
Gracias. Gané la batalla.
Me siento feliz porque sé que ya muy pronto va a estar nuestro hijo acá con nosotros.
Marvin y Junior se volvieron a hacer el examen y pues esperamos unos días y nos llamaron para darnos el resultado que ellos ya habían salido negativos.
So hard. And today's going to be a very special day because you're going to meet your mommy and your daddy and your brother. I love when he does that. It's like I was his mommy for the last 5.5 weeks. And I gave him as much love as I would give to my own son.
Me siento emocionada, feliz que ya viene Neisser para acá. Siento que mi corazón me así de la emoción de ver por primera vez.
So this is a mess right now because we're trying to pack everything for Zuli. There's some extra donated milk, his little stroller.
¿Tú lo llevas, no, mi amor? Te las llevas en el carro y yo te lo das. Él quiere darle las moradas a mi vida. ¿Ok?
Yo siempre darle una vida mejor a él. Porque yo sé que en Guatemala tal vez no se la puedo dar, pero acá, ya que Dios me dio la oportunidad de estar acá, pues seguir luchando para que él sea una persona importante.
Está en prison. Oh my God, okay. Bye, baby.
Oh my God. Look at tu hijo, Zuli. Mira tu hijo, Zuli.
Mira tu hijo. Junior. Dame un abrazo, mujer.
Gracias.
Ay, qué mami más linda.
No, papi.
Hola, Aurora. Tengo una cosa importante.
Ah, sí.
¿Está lista?
Ay, mi bebé.
Tu hija con tu nieto, Aurora.
Ay, sí.
Mira, finalmente.
¿Cómo te sentís, mamá?
Feliz, mamá.
Queremos hacer una oración. ¿Será que usted tiene un minutito para hacer una oración con nosotros?
Ok. En este momento te pido, Señor, que bendiga grandemente a Zully, Marvin, Junior y especialmente a Miss Lira.
Sentía una alegría porque desde cuando yo empecé enferma mi madre nunca me había dejado, siempre ella en sus oraciones.
A todo este hogar, sigamos adelante, luchando, pidiéndole a Dios por nuestra vida y protéjanos, Señor, hoy acá en este país de Guatemala, porque ha llegado esta pandemia hasta nuestro lugar. Gracias, Padre. Amén.
Fue un día maravilloso. Nunca me imaginé que a mi mamá le iba a pasar esto. Mamá, ¿puedes hablar o no? ¿Te sentís bien o no?
Dolor de hueso, calentura, la cabeza, no aguanto respirar. Síntomas de COVID.
Te quiero mucho, mamá. Vas a estar bien, ¿oíste? Vas a estar bien. Dios está contigo, ¿oíste? Tienes que estar con nosotros. Te voy a llamar al rato, ¿sí? Para que descanses un poquito. Ay, Dios mío. Esa es una pesadilla, por Dios mío. Yo pienso en muchas cosas. No entendemos por qué nos dio el coronavirus. Mi esposo, mi hijo, mi hermano el más grande, el pequeño, mi madre, mi padrastro y mi cuñada y mi sobrina. así es la vida. Hubieron personas que quizás se fue toda su familia, pero por lo menos nosotros estamos vivos. Quizás si hubiera estado en Guatemala, quizás no me hubiera levantado ni estuviera contando lo que estoy contando ahora. Gracias a Dios, por el momento todos estamos bien.
For more on this and other Frontline programs, visit our website at pbs.org/frontline. Frontline's Love, Life, and the Virus and Undocumented in the Pandemic are available on Amazon Prime Video.
So welcome back, everyone. I hope you enjoyed the film. I know I did. I have to admit, this is the 4th time I've actually watched it. And every time I feel moved and inspired and comforted by Stanford's enormous capacity to be a welcoming and caring community. Let me introduce again our wonderful panelists, Oscar Guerra, the director and producer, Dr. Bernstein, the Associate Director of Pulmonary and Critical Care at Stanford Hospital, whom you saw as well in the film, and Luciana Lira, the teacher who graciously took the newborn child while Sully was, and their family, fighting COVID-19. I wanted to remind you and let you know that, again, we'll be recording this session just for internal purposes. And also remind you again, and I know Krista put it on the chat, that we'll be taking your questions at the end. So please put them in the Q&A box, as we will be taking them after our conversations. So my first question is actually for Oscar. Oscar, I've always felt that concocting titles for books and films and alike is an art in itself, and I find it to be a very difficult one. How did you come up with the title of the documentary?
So I think that the title of not just this documentary, but any piece, it's always the most difficult thing, because it should, in a way, describe what the film is about and what the film is not going to be about. The title was very important for us because it was, we're trying to connect audiences with this. And we did a lot of brainstorming. We had a lot of names, and we ended up going with the title that the executive producer, Frontline, Rainy Rat Aronson, she came up with this title, and we said, you know what, it just clicks, because that's the reality of what the film is portraying and what everyone is going through. You know, we're dealing with the same situation. We're going with those 3 elements. you're dealing with love, life, and the virus with this pandemic. And I think it was a good way for us to connect with audiences, regardless of where you're coming from.
Thank you, Oscar. I was always intrigued because the first time I saw it, and I love the title, it kind of reminded me of the novel of Garcia Marquez, Love in the Time of Cholera. And I thought, yes, somebody had to put this in a book or a film and in this wonderful and inspiring documentary.
Thank you so much.
Do you want to say something else?
Yeah, I mean, I was just gonna say that it's also represents what the hardships of shooting during a pandemic. You know, what we were trying to do with this. But I'm sure we're going to talk a little bit more about that later. So I'll go back to that.
Wonderful, thank you, Oscar. So my second question is actually for Dr. Bernstein. We've heard many times that there is a stigma, particularly at the beginning, that COVID-19 only affects people of an older age. Can you describe the demographic of those affected in general, but if this demographic is any different in Stanford or Fairfield County compared to other places in the country?
I think the demographics have changed over the last couple of months, certainly as we move from March and April to where we are now. Doctors all take statistics in med school, and I think over the last 6 months, everybody in society has become a bit of an amateur statistician, learning about incidence and prevalence and all kinds of crazy terms. But currently, the state of Connecticut has a great website that actually gives the demographics and the cases for COVID pretty much every day. And I was actually looking at it this afternoon. And if you look by age and divide it by 10-year marks, 20 to 30, 30 to 40, 40 to 50, pretty much at this point, the number of cases is exactly the same in each decade of life. Under the age of 20 is still much, much, much less common than any other age. Now, the prevalence may be more kind of evenly spread out. The death rate is actually not. That really skews to patients being older. But at the moment, we're not seeing patients who are quite as sick, and we're seeing people across all ages who have COVID.
And when it comes to demographics in terms of the Latinx community versus the Black and the white, I've seen some data on this respect. Is there anything that you would like to share with us?
You know, I think if you look at maps of the country, COVID is not evenly distributed. And in fact, if you look at a map of Stanford, it's not evenly distributed at all within our own city. And this has moved around over the last couple months. But it certainly impacts communities that live closer together. It probably certainly impacted early on communities that could not socially distance, either for economic reasons, having to go to work, or just they all live in close-knit quarters and communities. So that, I think, drives a lot of it. There's also a disproportional burden of COVID for communities or people that have certain comorbid diseases. What I mean by that are people who have diabetes or obesity, hypertension, and those are much more common in the Hispanic community, much more common in the African American and Black community, in Stanford more common in the Haitian American community. So it's kind of a double hit together of communities that can't socially distance as well, and also have a number of pre-existing medical issues that make the disease worse.
Yes, thank you for talking about that. We have been participating for quite a while in this task force for high-risk communities, and we've been particularly worried about the Latinx communities and seeing the numbers, as you mentioned, in the city going up. So thank you so much for building on that and give some clarity. Luciana, this one is for you. It is very clear in the story that you are certainly one of the heroes. I know you are one of my heroes and many people as well. You had no hesitation to take care of the newborn in the midst of so much uncertainty, while also having your own family. You had a young son, navigating distance learning. And as a teacher, I just imagine how incredibly busy you yourself probably were trying to navigate distance teaching as well. But you and I have discussed before how so many people from the community rallied around to support Suli and Marvin and the elder brother Junior and the baby and yourself. There were many others who contributed to Suli's story, lots of people expressing their humanity. So can you please give us some insight on the community support that took place during Love, Life, and the virus that did not perhaps make it to the documentary?
It's really hard to speak about everybody who made a difference in my life, in baby Nasel's life, and Zuli's life, and obviously my family's life. The entire community here in Stanford, I think United States, I mean, everybody helped so much from day one when we found out that baby Nasel was born. I opened a gift registry with my colleague from work, Lucy Santora from Heart Magnet School. Within 3 hours, the entire baby registry was purchased. So from that moment on, everything just started working so well. I mean, B1C, Catherine her rec was so nice. All of you guys at B1C, the staff, the doctors at the hospital, Stanford Hospital, everybody at Heart Magnet School, Nancy Stanton, Danielle Penzella, Lucy Santora, Mrs. Darling, the entire Heart Magnet family, they were just so helpful. I also wanted to say thank you to Joy Colon, who helped so much putting the story out there too. And so many people, Julie Fraser, and I cannot speak more highly of my friend Oscar Guerra and John Moore. I did not know them before all of this started. And those two men entered my house. Actually, they were the only two people during the 6 weeks that baby Nasel was with me. Oscar and John were the only people who entered my house. And from day one, I trusted them, and Katharina too, she entered my house, but nobody else. Those three were the only people who I would allow to come into my house, you know, to help me and help my family and get all the footage they did for this beautiful documentary, which at the time we had no idea it would become a documentary. I don't know, I thank you, all of you. I hope I'm not forgetting anybody. You guys were all amazing. Thank you, Stanford. I know we have a lot of problems in our city, like everybody else does, but I have to tell you something. We should all be extremely proud of Stanford because it is an amazing city. When we have a problem like this, everybody rallies together to help their neighbor. So thank you, all of you, for being so amazing.
Thank you, Luciana, because that's pretty much how I feel. We receive letters from people in Florida that learned about the case and about our organization thanks to this inspiring documentary. And I'm very happy that you mentioned all these people. I know the Tiny Miracle Foundation was there as well. You don't have to, don't put that face. There were so very many people that did things. People like, even I heard that your landscaper is also from Guatemala, and he himself, you know, supported the GoFundMe campaign. So there are so many people with so much heart that supported, you know, you, your family, and Suli's family. So this is very beautiful. So thank you for bringing all
One more quick thing I wanted to say. I also wanted to say thank you to obviously Zuli and Marvin for trusting me. I mean, Zuli for calling me right before she couldn't breathe anymore, and she called me and asked me to help, and I heard that call. So thank you, Zuli, for trusting me and calling me.
Thank you, Luciana. Oscar, I'm back to you. You told me before that there were over 40 hours of footage that you actually took over this long time that the story went on and on. How did you decide the narrative based on all the footage that you captured throughout so many hours of filming?
I think that's the toughest part of documentary, is that you're going to have so, you know, this story could have gone in so many directions. At the end of the day, you have to work with what you have. And sometimes what you have is a lot. So it was almost, imagine having 40 hours of video and trying to compress everything into 33 minutes. So it's a lot of, you know, when you choose something, you're renouncing to everything else. So you have to start to come up with this narrative. You need to have a great team. And I think that I was fortunate enough at this moment, when I started, I was not sure that I was going to partner up with Frontline and later on with Univision as well. But I think that Frontline was the right partner for me, because they had a group of very, very talented people, and it was a lot of back and forth. We're saying, okay, what's going to be, what's the main idea that we want to communicate? And it's almost like writing an essay. Once we have that idea, we start building paragraphs, and then we have to go back and say, okay, this is what we have. How can we put it together so it's something coherent, something that is going to drive the emotion, but at the same time is going to be able to inform you what we want to say. So it's a very, very exhausting process. For the past, I started teaching now, so I'm a little more relaxed the way it was, but it was 5 months that it was nonstop. It was working, shooting during the day and editing and writing at night. Then taking care of a 2-year-old while my wife is either working or asleep. So I understand what Luciana is saying. I'm sure Dr. Bernstein went through the same. I think that now everyone's a bit more relaxed, but during the insanity of the peak of the pandemic, it was not easy for everyone. So having to deal with a lot of footage, it's like, what do you choose? I think that was one of the biggest challenges. But I'm happy. I think that I was able to partner up with a great team, and we were able to tell a story. And again, this is one of so many angles that are out there. We wanted to make sure that the angle that was presented here was one that was championing the reality of what happened here when a group of great people decided to get together and start working as one. I think that we're almost a case study of what can happen when people get together and decide to do things right.
Completely agree. And I think you did a great job putting this narrative together. I'm sure you could have gone, like you mentioned, in so many very different ways. This one came out absolutely fantastic. So thank you for putting that story. Are you thinking of perhaps creating more streams out of this footage, or any plans for that?
I mean, I remember that I had this conversation with Luciana. I told her, well, maybe we're going to do the next part, because she said that she was going to take baby Nasal back to Guatemala, so baby Nasal can meet Grandma Aurora. So that would be its own documentary, you know, like how this young Guatemalan American is going back and being reunited with the help of the teacher. I think that's a beautiful story on its own. So stay tuned. Maybe me and Luciano will have to talk at some point. Maybe we're going to do that. There are so many ways in which we can go, but we'll see. We always try to keep a very organic approach and let the story guide you, and not the other way around.
Yes, that'd be a great follow-up. And I know many of us here today would love to watch it. Some questions are coming. I'm just going to answer this one, and we'll go into questions later. But some people have asked already, how is Sully and how is the family? And I just want to very happily say that they are doing well. Baby Nasal is the cutest baby you can imagine, and they are doing well. We've been having them at the center for different services, and it's a pleasure. Every time they come, they are our little celebrity, and our heart is with them all the time. So Dr. Bernstein, we are approaching the fall. It's cold already. I'm a Latinx person here, so every time I'm out, I'm cold. So we're approaching the fall fast and furious, and we've been warned endless times about possible waves. So we're all going to be indoors, closer contact among each other, particularly difficult for low-income folks, many of whom are immigrants, that oftentimes live in overcrowding conditions, as you were mentioning before. So my question to you is, can you remind the audience, what do you do if they think, or someone they think, or someone they know they think they have COVID-19?
Well, I think the first thing is just what can we do to prevent somebody from getting it? Everything about COVID, unfortunately, has been politicized, but it's unequivocal that wearing masks make an enormous difference. And it can't be understated. Every day, there's more and more evidence that it may, it can absolutely reduce spread. And in fact, there's more evidence that it probably reduces the severity of the disease if you have it. So I would tell you, don't go more than 3 feet without having a mask with you, because you never know when you're going to actually need it. And you're right. The most important thing, I think, is to also not get swept up in the stigma of having COVID. And I think that's one of the things that could be the most damaging, particularly in communities that live in tight quarters, is people not feeling comfortable about saying they're not feeling well, about not going to get tested, and not being forthright with each other. Somebody's going to get COVID in Stanford this winter. In fact, a bunch of people are probably going to get COVID. And if we hide it and try to keep it behind doors, it's going to spread worse, I think, in that scenario. So there's a number of resources to get tested. They can be found available through both Stanford Hospital, state of Connecticut has testing. And if you think you have it, you need to isolate yourself. That's really the most important thing, to the best of your ability. And that's really an important thing. And if you can't isolate at all where you are, then we need to work with the city of Stanford trying to find people and separate out to get people from there. We keep hearing that COVID's a public health crisis. It's not an individual health crisis for people. So keeping everybody together in terms of separating for that is probably the most important thing. The science is going to evolve over the winter as we understand more how to test, who to test, when to test, what types of tests to use. It's all changing pretty rapidly. So we need to keep people informed on it, and don't feel like you heard something in July and now we're telling you something different in November because we didn't understand that. We gain knowledge of this disease. I know 2020, it's felt like it's gone on for 20 years already. But if you remember when the ball dropped on July 1st, not July 1st, the ball dropped on January 1st, none of us had ever heard of COVID. It just didn't really exist in our minds. It was somewhere in the world, but we didn't know of it. So it's been a fast-paced year, but a slow year. And we just have to remember that this winter.
Thank you for saying that. Totally agree. We have to work on prevention to start with. And I heard the other day that even beyond any vaccine is a mask right now. So we have to remind ourselves to do so. I see many questions coming in, but Luciana, I have a last question for you before we take some from the audience. As a bilingual teacher in close contact with many immigrant children, what do you want others tonight here with us to know about your students and their families' lives?
I think the most important thing that I would like everybody to remember is that the immigrant families come to this country because they're looking for a better life. They're coming here because they need to be here in order to be safe, to have food on their plate, to have a house, and most importantly, they want their children to have a great education. They all do. We need to remember that a lot of these parents, I'm not saying all of them, but a lot of them have a really hard time reading. They have a really hard time, writing. So we must, as adults, as parents, as this community, we need to get together and help these parents help their children, because they do want their children to get a wonderful education. So we just need to help each other, because if we all help each other, this community will be even better than it is right now.
Thank you for saying that. I agree with you. And I think the film itself is a testament of people coming together and helping. And I really love that. So thank you so much to the three of you for your thoughtful answers to my questions. Now we have even better questions from the audience. So bear with me. We're trying to put them together by panelists. And I want to address some of them. Here are three questions for Oscar combined. Let me start with you, Oscar. How did you originally find this story in timing for filming? How did your crew was able to film with very moving scene? What's your intention for the film? What did you want to show? What was the intention for the film? I guess. What did you want to show?
Okay, so starting with the first one, the one which I heard about the story. I mean, everything started when I got in touch with photojournalist John Moore. I told him, hey, I want to start shooting a project about you. At that moment, I was not shooting a documentary about Suli. I didn't even know about Suli. But again, the documentary works in very organic ways. I got in touch with John Moore, who's also a Stanford resident. And I told him, hey, I might be able to go into the hospital, and I think that those will be really good. And he told me, well, by the way, Catalina Hort from Building One Community told me about this woman whose name is Sue, and she has a great story. So let's see if we start doing something. And to be honest, it was like that. I knew that John was local. I didn't know him at that moment. I just sent him an Instagram message, and I say, hey, I'm a professor at UConn, and I want to start doing something. For me, it was important to document it one way or another, and that's how the production started. And funny thing that whoever's asking that question said about my crew, there was really no crew. It was me. It was like a one-man band all the time, and that's the way COVID changed for everything, even in the way we film and produce. Usually I have 2 or 3 people helping me out with sound, with camera, and sometimes at least, I have a very heavy camera with a very heavy lens, and you have to run around with that thing for, it was like 5 weeks that I ended up shooting. My back was killing me, but you have to do what you have to do. When Suli's mom got so sick, she called me, it was a Sunday at 11 p.m. And she told me, I think she's not going to make it. Can you please get here? And a couple of minutes later, I was already there. So it was a one-man band operation that was really interesting in the way it was tiring, but you have the adrenaline rush. And I think the third question, because I'm trying to be brief with my responses, the third question was what I was trying to communicate.
Yes.
Yeah. I mean, I don't know. The reality is that I wanted to tell an inspiring story. I think that one of the things that I started reflecting later on, and actually never shared with Luciana, I think that we were all doing our job. The hospital did a great job building one community with Catalina, who was in your position before. Building one community was doing their job. Tiny Miracles was doing a job. John Moore was doing his job. I was doing my job. Luciana this was not part of her job. I just say, imagine like receiving that phone call. What would you do? And I think that also inspired me to say, hey, what if this is a call for action, that maybe we can do something no matter what. And in the film, you see Luciana, she's saying, I'm just a teacher. I'm just a teacher. She's saying, I'm just a teacher, but imagine what can you do if you're a teacher or whatever. And I think that was what I was trying to communicate. And having this great relationship, I think that Luciana, Catalina, John, Andy Jotko from Stanford Health, we became kind of like this coalition. We said, we're here to help Suli and her family. Let's do this. And that was the goal. And I think that we achieved that goal. I think we made it.
I think you did. And just want to say that, yes, I can attest that you were a one-man crew. I've seen you at B1 Scene many times and carrying this heavy equipment. And yes, I think it talks about the quality of the people surrounded, doing their job, but doing their job with a lot of passion. Right. And I said that there are many heroes on the stories, and I have to do a shout out here to John Moore as well, because I think he stood up from the very beginning, doing his job, but going beyond his job as well.
If I may interrupt for a second, it was because of his pictures that we got this national attention, you know, and we all benefited from it. Suli, Luciana, Building One Community, myself, you know, everyone's doing their job and everyone's trying to help each other out as a community. That's why I think, you know, I've been here in Stanford for a year, and I think it's the place to be.
I agree. So Luciana, I have here 2 questions for you. And they are as well combined. Did you ever regret that you undertook this endeavor, that you actually took the baby home? And a follow-up question, was it difficult to give back the baby? Because even though you're not his biological mother, you still created a bond with the baby for the first 5.5 weeks.
First question, if I regret, there's no regret. I've never even thought about not taking this baby and taking care of him. That never even came through my mind. I would never even think about regretting it because I'm proud of what I did. And I really hope nobody would have ever said no to this because this baby's here, healthy right now. And no regrets, never, ever. Number 2, second question was, oh, giving back the baby.
Yes.
From day one, I know this was not my baby. From day one, I knew he would not stay with me, even if his mom did not make it. So was it hard? Yes, it was very hard because for 5.5 weeks, I loved that baby as if he was my son, as if he was my own son. And I knew I had to give him that love because if I didn't give him that love, that mother love, who would give him that mother love? So I did love him as my son. Was it hard to give him back? Yes, it was very hard. But from day one, I knew he wasn't mine and he just needed a mommy. So I was his mommy for 5.5 weeks and I'm proud of that. And I will always love him as my son and I'm gonna be his godmother. So I'm very proud of that too.
That's awesome. And I've seen you together and it's just beautiful. You can see that bond that one of the audience's members asked. I've seen that bond in real life. That's beautiful. Dr. Bernstein, I have a couple of questions for you as well. Someone is asking, wondering why Stanford Hospital rushed the patient so quickly, and somehow related, what kind of public policies need to change to avoid having discharges on little or no notice?
Well, I'll just leave it at this. I think I want to respect the integrity of the documentary and the filming. The perception of the doctors of the hospital, of the nurses and the staff is that part wasn't really portrayed the way we see it as going. And some actually took a lot of, I don't want to get into that because I don't think that's exactly the way we felt it went down. Just speaking of that, this was a very weird time. You know, the military was at Stanford Hospital working with us. It's not a normal way we would function, but you raise points of discharging patients is always complicated, and it's certainly more complicated based upon the resources they're going home to. And people come from non-resource equal environments coming into the hospital, and they go home to non-resource equal environments leaving the hospital, and that's really a challenge. Healthcare in 2020 isn't, unfortunately, just the hospital. It starts at home, it's in doctor's offices, it's in rehabs and nursing homes, and they're not equal in that ability. Fortunately, Stanford Hospital is a non-for-profit public institution in Stanford, and we take care of people regardless of their ability to pay. But many rehab facilities and other resources for discharging are not the same, and that becomes an issue.
We've been working closely, particularly I've been working very closely with the Stanford Hospital, and I can attest all the efforts that the hospital has put together to, particularly towards the immigrant community, you know, the Caribbeans, and as I was mentioning before, for this Hispanic, the Latinx community. So I can attest of all the things that the hospital has been doing for the community. Someone is asking, how can we bring this wonderful documentary to more people? It is very important for everyone to see how we all work together around love and building communities and welcoming diversity. Oscar, do you have, and I know that the documentary was shown in PBS, on PBS, August 12th, I think it was, and then a couple of days later in Univision in Spanish. Any other? Tell us more of how we can show this around.
I mean, the beauty about partnering with someone like PBS is that PBS, you get all their content is available online. You don't have to pay for it. So how can you do that? Well, we can certainly share the links. If you go to YouTube, you can even get the documentary there and just sharing, I think that sometimes, we can do something like this where we have a panel where there's going to be a national panel where we're going to screen the documentary as well with Frontline. We're going to have I think that they're thinking about inviting the mayor of Stanford and inviting some other people. So those type of events are very important, but also the individual, just copy pasting the link and sending it to your contacts. That's the best way to distribute it. That's the best way to do word of mouth, so to say. And for that person who has that question, I would just say, if you go and have the link, share it to your contacts. And I think that people are realizing that since this tries to be a documentary that talks a lot about the emotional part of it without being an investigation about what happened and what didn't happen or what should have happened, that was not the case. That was not what we were going for. This was more an emotional piece. And I think people are going to be able to connect with that. So just share, copy paste it and share it with your messages through WhatsApp, social media. And we would all appreciate that a lot, actually.
Thank you. I have another question for you, Oscar. It reads, Building One Community has participated in so many impressive immigrant stories. Would you consider filming another one with this organization?
Of course. Of course. One of the things that we have to do as I'm a filmmaker, but I'm a filmmaker that as soon as I moved here to Stanford, I went and introduced myself at Building One Community with Catalina at that time. And I said, hey, this is who I am. This is what I do. I'm an activist. I'm always producing documentary for social change. And the people that tend to be the gatekeepers and the people that know about the wonderful stories is you guys. It's people like Building One Community. So yes, let's talk.
We will. And last time we spoke, I told you we have some ideas in mind already, so stay tuned. Mm-hmm. Dr. Bernstein, you were mentioning before that and this is not a question here, but kind of like a follow-up of mine. You were mentioning before that the best thing we can do is actually prevention, and is the mask wearing. And this is something that at Building One Community we take very seriously, and every time, and we've been very fortunate to receive donations of masks. So that's something that every time someone at our center comes for any of the services that we provide, we always make sure that that person leaves with more than one mask. Is there any other thing that we should be thinking now? Again, my fear is that during the summer months, the bad time was for the South states where it was very hot and people were indoors, and it was a blast for us because it was hot in here and we could actually be outside and nice outside. But now it's going to reverse. Very soon we're going to be again indoors. And I've heard before about people saying you should wear masks even when inside and so on. What kind of education around mask and prevention measures we can actually put out there?
Well, I think there's two issues. One with masks, you really can never go wrong with a mask. And I think that's something to go from there. And I think we all have a responsibility of sort of encouraging and teaching people to wear masks. My kids are in the Stanford school system. They're, started a few weeks ago, and we had them wearing masks over the summer and around, and they never felt uncomfortable wearing masks. So as parents and leaders, we should model by wearing masks. And I think if you're around somebody and you're worried and you can't get away and you've been in a place where you might have been exposed, you wear a mask. It's not too hard. I think the other issue that's worth talking about right now with organizations like B1C is vaccination over the next coming months. There's going to be, again, I mentioned this, everything gets overly politicized, but doctors like me who are pulmonologists, actually trained also as a pediatrician, we love vaccines. And we're going to need to be able to communicate who should get a vaccine, that it's safe for communities that are at high risk. And distributing these vaccines are not incredibly easy. The vaccine actually has to be kept at minus 70 degrees centigrade. So it's not easy to move it around. So the logistics are going to be tough, and it's going to require community organizations to get the word out, to make people feel comfortable, to know who needs to get it, because that's sort of the second wave, and not the wave in terms of infection, but the second wave in terms of prevention.
And we'll be there to do whatever is needed. Just last night, we had a partnership with AmeriCares and Walgreens providing flu vaccines. So we're there all the way with the community. I have another last minute question prior to one with which I would like to close at some point. The film is an American story, an immigrant story, a human story. It is so powerful and impactful here in the US and in Connecticut. But have you received any feedback on the impact and meaning worldwide with its Spanish language release? How is the feedback different or similar? Oscar, would you take that one?
Sure. I mean, I was curious to see, because I'm sure Luciana would have some feedback from Brazil as well. I certainly have some feedback that I've received from different states, but also from Mexico. I actually was invited to give a guest lecture about the film at a prestigious Mexican university, Tec de Monterrey, early this morning. And I think that people are receiving it very well. They're understanding, guys, this is a thing. New York City was pretty much the epicenter, the way in which Italy was at some point. It was big. So what happened here, that's why I said that it almost became a case study. So I think that people are looking at the film I think that we can connect as residents of Stanford. When you see the statues, you're like, oh, I've been there. But I think the type of feedback that I've received, and this is just feedback that I've had after different screenings, is that people are seeing it as, oh, wow, I didn't know that was actually happening. I didn't know that people are actually getting sick. I didn't know that people can actually help out doing these things. So for many people, I think that this has been a window into what happened here, almost like we open a little window and say, hey, this is what's happening here in our home in Stanford. I think that the feedback has been good in general. The Spanish version, and with the help of Univision, we were able to connect with millions. So we needed to do that. I think that we're trying to make sure that we connect audiences. You're always going to have people that don't agree with immigrants, and of course you're always going to have that feedback, and that's always a percentage that it's going to be there, which is, it's okay. It's opinions, but I think that the majority of it is that people are connecting at an emotional level with the film, and that's what we try to do. People are connecting with the different characters. They're connecting with Luciana. They're connecting with Sully. Even people are connecting with someone like Junior. This little kid who went through so much, and that could be its own documentary on its own. What's happening with our kids at this age, that they're going through so much with online learning, dealing with adult situations. So that's some of the feedback that I received, but of course I would love to receive more. Some of the people at my university at UConn, we have a great group of people that are doing a lot of online research. So we're gonna keep doing more. There's some preliminary research about what people are thinking about the film online, and I'll be happy to share that with Building One Community as well.
Would love to hear that. And I'm gonna ask Luciana about Brazil, but before that, I wanna say, you can tell I'm an immigrant myself, but my family is all over. And throughout Sully's story and those 5 months, 5 weeks that you were filming and so on, but we lived this story very long and post-release and so on, I've been telling my family back in Spain and in Croatia Suli's story and what Luciana was doing and the hospital and yourself. And I can tell that by my little family community was very well received there too. And they were waiting to see the film itself. And so it has gone beyond. Luciana, what can you tell us from Brazil as well?
Well, Brazil, I was interviewed by many TV channels, television channels. So I was in the news there. But not only Brazil, but Abu Dhabi, Japan, Australia, people from India, South America, Central America, I mean, Africa. I have messages, thousands of messages of people telling me how this story inspired them to become a better person, and how this story inspired them to get out of their little shells, get out of their house and help their neighbor, obviously in a safe way, but help their neighbor. You know, just make that little phone call and ask, are you okay? Do you need anything? You know, and that's amazing. I really think, Oscar, as you were saying, you know, this is a documentary that is not only, you know, teaching about the virus and love, but it's also teaching about being a better person and how a little act of kindness go a very long way. So yes, I think this documentary is very important because it opens up everybody's eyes, but it also opens up everybody's heart to become a better person. So thank you, everybody. You're all amazing, seriously. I cannot thank you all for always being there for me and this family. Thank you.
Thank you, Luciana. I am surprised. I knew it was wide and I thought that Croatia was far, but hey, we've been everywhere. You've been everywhere.
Everywhere.
I'm so happy. I'm really, really thrilled. We don't have much time, but I want to close with one question. And before my perhaps closing remarks, I want to give you the chance if there is anything you want to say. And if not, there is a comment from an anonymous audience member that I wanted to share as well. And at the time we do that, I also would like to share one picture that we took at B1C from Suli and her family, one of the last visits. So here is the picture, and I will share the comment at the same time. What an amazing, beautiful story. How can we use each of your courage, compassion to kindly grace and kindness among a nation torn by fear of COVID and people who look different? And I just wanted to close with a picture because I think kind of says it. I think this beautiful family and again, the whole community that rallied behind is kind of answering this question. So we are coming to an end now. I just wanted to thank everyone again. This has been a very engaging evening. The inspiring conversation with our panelists and our audiences incredible and solid questions only reinforce, in my view, once again, how much we care, as you were saying, Luciana, and that we're all in this together. And that in high moments like this one, the ones that this pandemic actually brought on to us, as Dr. Bernstein was commenting, we do act as a strong, cohesive and welcoming community. So thank you again for our panelists for an inspiring conversation. Tons of virtual applauses go to you all. Thank you everyone for joining us tonight. We love having you all here. And I want to say one last thing is that on October 22nd, please stay tuned for our virtual colloquium. Again, at 7 p.m., we're going to have a conversation with Roberto Gonzalez. He's the author of Lives in Limbo, Undocumented and Coming of Age in America. It's a book that follows the story of undocumented youth for 12 years. So please stay tuned because I promise it's going to be a very great event again. Be well and thank you again. And thank you so much, everyone. And thank you to the team behind the scenes that have been working so greatly in so many different layers. We're finishing on time, and I look forward to seeing you all, including connecting from to our friend from Oregon. Good night, everyone.
Good night. Thank you very much. Thank you, Anka, for hosting.
Thank you, Anka.
Our pleasure, completely our pleasure. Thank you, Dr. Bernstein.